This demonstration is a guide to injecting with the Skyrizi pre-filled syringe. Watch it and also read the entire Skyrizi instructions for use leaflet inserted with your medication package. Don't try to inject Skyrizi until your doctor has decided you can and you've been shown the right way to inject. Skyrizi, Risankizumab uses. Skyrizi is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy. With active psoriatic arthritis, PSA. Safety considerations. Skyrizi may cause serious side effects, including serious allergic reactions. Stop using Skyrizi and get emergency medical help right away if you get any symptoms of a serious allergic reaction. Infections. Skyrizi may increase your risk of infections. Before starting treatment, your doctor should check you for infections and tuberculosis. Tell your doctor right away if you have an infection or symptoms of one. Do not use Skyrizi if you are allergic to Risankizumab or any of the ingredients in Skyrizi. Also, tell your doctor if you plan to or recently received a vaccine.
Hey there, I'm Maya, and I'm here to walk you through how to inject yourself with Skyrizi. Now, if it's your first time, don't worry. And if it's not your first time, I hope you pick up some new tips while you're here. Now, I've done this a few times by myself, but my doctor originally walked me through how to inject, and I called Brian, who's my nurse ambassador, when I first started injecting on my own at home. All right, let's get started. So when my Skyrizi comes in the mail, it goes straight in the fridge. Now, before I inject, I let it sit out for 15 to 30 minutes out of direct sunlight to get to room temperature. And while I wait, try to relax. Okay, that should be enough time. So once my hands are clean, I like to put out everything that I'll need. So I have my Skyrizi syringe. I have an alcohol swab, which I got from my local pharmacy. I also have the instructions for use, just in case. And I also like to grab a cotton ball. I had some right in my medicine cabinet, and then a sharps container. Now, I like this spot because there's a lot of space, and I don't have to leave my couch. So it helps me to break down the injection process into 4 simple steps, the 4 P's. And you can see them here on the package. We have pick, prepare, pinch, push. Okay? So first, I pick my injection site. So I'll go with my left thigh, but you can also pick your right thigh or your lower stomach. But if you choose your stomach, make sure to inject at least 2 inches away from your belly button, okay? So you want to grab your alcohol swab to clean your skin in a circular motion like this, okay? And let it dry. Now I hold my syringe with the needle facing down, and I check the liquid inside to make sure that everything looks okay. So it should be clear to slightly yellow, which it is. See that? And there's a few bubbles in there, but that's normal. So looks like we're good to go. All right, so I hold my syringe in one hand, and I take the needle cover off with the other hand, okay? Like this. And then you want to throw it away. You see? You may see a drop of liquid at the end of the needle, which is normal, okay? So I've got my syringe in one hand, and with the other hand, I'm gently pinching the area of my clean skin to hold firmly. Now I'll inject the needle into my skin at about a 45-degree angle using a quick, short movement like this. Now holding the angle steady, I slowly push the plunger in all the way until all the liquid is injected and the syringe is empty. There we go. Now pull the needle out of my skin while keeping the syringe at the same angle like this, and I release the plunger to allow the syringe to move up until the entire needle is covered up by the needle guard. See how that works? The needle guard won't come back down unless all the liquid has been injected. All right, so now I press my cotton ball where I just injected, and that's it. I drop my used syringe in one of these handy sharp disposal containers, and voila, safe and sound. Now I'll just put it back out of reach, and just like that, another injection complete.